Important discharge teaching for antibiotics. According to the Center of Disease Control and Prevention, or the CDC, 2 million cases of antibiotic-resistant bacteria occurs every year, resulting in a loss of nearly 23,000 lives in the U.S. alone. Many of these cases may be prevented through stewardship programs and better overall education on the proper administration of antibiotics. This presentation was created to implement a discharge teaching plan catered to patients being discharged on antibiotics. After this presentation, the goal was to see an increase in nurse confidence discharging a patient with home antibiotics. The focus of this education was on teaching nurses common side effects and risks associated with poor adherence to antibiotic regimens. Outpatient antibiotic use accounts for around 80% of human antibiotic use. It is considered the principal driver of antibiotic resistance in the community. Nurses play the role of the median between the doctor and the patient and can often be the sole educator for the patient's home regimens. Without proper education, patients often may misuse or stop using antibiotics altogether, which may lead to further complications down the road. The literature sources used in this presentation were from a collection of articles ranging from 2015 to 2021 from CINAHL, UC Libraries, PubMed, Scopus, and Dynamed. Keywords used consisted of antibiotics, antibiotic therapy, discharge teaching, nurses, inpatient resistance and infection, and antibiotic guidelines. To assess the effectiveness of education, a link to a 5 to 10 question pre-module survey was sent to the emails of nurses on the unit. After taking the pre-module survey, the nurses reviewed a PowerPoint that outlined different topics and techniques used to teach and assess overall patient learning and understanding to increase the competence and confidence of these nurses. Following the educational module, an identical post-module survey with identical questions was embedded to assess the knowledge gained from the lesson. The education took place on March 10th at University of Cincinnati Medical Center in Cincinnati, Ohio, to the nurses of 6 Northwest, a medical surgical unit specializing in orthopedics and cardiac patients.
As previously mentioned, the nurses on the unit were given a short PowerPoint presentation along with a pre- and post-survey. The surveys were identical and consisted of 4 multiple-choice questions, 3 select all that apply, 1 true and false, and 2 of rating confidence on a scale of 1 to 10. Due to COVID-19, our education model was conducted virtually. Even though most nurses on the unit engaged with our materials, only 11 completed the pre- and post-assessments. From the nurses who completed the surveys, 82% improved their post-assessment score from their pre-assessment, and 90% of nurses indicated that they felt more confident about discharge education for patients with antibiotics after receiving our educational model. Although there was an overall increase in knowledge, our teaching could have been more effective. We could enhance future studies by tweaking a few factors such as having a larger survey size, a more diverse educational model, more time, and creating a sample that nurses could use as a resource during discharge. Presenting in person would have allowed for better interaction with the target audience because they would have been able to ask questions and receive additional feedback, which would have provided more meaningful and convenient education for the nurses on this unit. And here are our sources. Thank you.